Pam Womack. I'm the Chief Executive Officer of the Mental Health Cooperative here in Nashville, Tennessee. And this is a case management agency that serves people with serious mental illness. This is an agency I founded 10 years ago. Basically, another person here and myself founded this agency because we were not satisfied at all with the provider relationships that we had in the county serving people with serious mental illness. I had worked in state government before that and had been a policymaker, and it was kind of intriguing to see if I could put the policies I was trying to put out for other providers, if I could do it myself. So I did, and here we are today. I started out with about 30 staff members and about 60 consumers, and today we have over 300 staff members and well over 4,500 consumers that we serve throughout Middle Tennessee and Davidson County. And I think that what I want to say about the technology that we've developed here through Blue Wing Consultants is that when I was at the State Department of Mental Health, I was struck with the lack of technology that providers had in mental health. And when I developed this agency, I really looked for some cutting-edge technology and some software systems. And I don't know if you are aware or not, but the deal in mental health is everybody always looks within their own industry for the technology, and all we ever looked at was software that either a mental health agency had developed or someone had developed for mental health. And that just wasn't working for us, so we took another approach. We were struggling with whether to build a system ourselves or whether to buy it. I mean, that's basically the choices a mental health agency has. And I met Louis Johnston, who is the CEO of Blue Wing, and he was here to work with us on our accounting software and really understood that at this agency the consumer or the customer is the center of all activities that we do. And that's really what business people do. I mean, they really look at customers or consumers as their main focus, and then they tie all the activities that happens around that consumer. He helped us realize that there was some other avenues that we could explore and some technology that we had no idea was out there. The Blue Wing Behavioral Healthcare System is really the tool that helped us understand the processes. That was the group that was able to sit us down and help us work through the processes, chart them, and then actually put that into a system that we can use. You have to have consultants that understand, because this is not mental health software. It's not mental health built. So you have to have somebody to lead you through what you do so you can develop the software. That's the part that the consultants helped us do. That's the business side of the software that a CFO or a CEO might tell you. But I'm also a clinician, and I can tell you from the clinical side why it's so good. This is activity-based software that whatever is going on with the consumer, either in the crisis area or the clinic or with the case manager, that's captured in real time so that whoever else is accessing the system knows in the moment what's going on with that consumer right at that time. And that's across the whole agency. Anyone who has a need to know can pull up the system, can pull up a consumer, and realize that what's really gone on in the last hour with that consumer. And the system has alerts so that if something, for example, a consumer doesn't show for a clinic appointment, immediately the system notifies the case manager, notifies the nurse. We know immediately that the consumer did not show. That sets up an activity for that nurse to make a home visit to find out what's going wrong. So it's not only helping us understand what's going on with the consumer, but each staff member is alerted to what's going on in real time. And I mean, there's no way any mental health software can do that. It ties everything together. I can sit in my office literally and pull up a record on a consumer and know everything that's going on with that consumer in real time. Up to the minute, there's no lag, there's no processing. And from the fiscal side, we had all of our case managers writing their notes, and then data entry was entering the notes. So we had electronic record, but we had a lot of data entry staff, typing out everything. And with this system, we were able to eliminate over 10 data entry process positions as well as medical records, because you don't have a need for the paper chart. When I first started this agency with 30 staff members, it was easy to sit in my office and have one-on-one with all staff, and my philosophy and the way I wanted things done, it was easy then. But when you begin to grow, like we have, through the years, up to 300 staff members across numerous locations, what I thought we had standardized didn't happen to be the case. And when we began to interview line staff, one case manager would differ from another case manager on what they did, and then that would even be different than what the supervisor was telling me was supposed to happen. And then we really started looking at what had been written down about what the staff should be following. We really didn't have anything in writing that the staff were going to follow, so we had nothing standardized. And that doesn't help you when you're trying to work with behavioral health care, because behavioral health care wants an agency that can standardize their practices. And we were very far from that. After we did the processes, then the technology was developed and we rolled it out. That part only took a couple of months after we got the processes done. Well, and the other benefit I would say to you about the system is, clinicians are not ones to want to use the computer. They're scared of it and they sure don't want to type their notes in. Once we got past that with the doctors, the doctors even enter their own notes, but once we took this to clinic, you would not believe the gnashing of teeth that we went through with the nurses. They didn't want to do it. It was not going to save them time. It was going to be clunky. They wanted to write their notes out. And we were able to save over 60% of their efficiency through this system. They were actually doing home visits before the system was implemented, and I think our whole agency was doing like 16 home visits by nurses in a month. And last month they did over 80, and it's over 100 this month. And the best sellers of this system right now are the clinicians. They will tell anybody that this has saved them untold hours, and what that translates into is direct time that you can have with the consumer. And that's what it's all about. The face-to-face time with the consumer that this system has allowed the staff to engage in has been the best reward of all. What's happened with the efficiencies that this system has saved us, that's turned into real dollars. If you save $1 million or $2 million the first year in staff efficiency, then what an agency like this can do that's a not-for-profit is turn that back into services for the consumer. We're able to serve the consumer better. We spend more time with the consumer. Staff are out of the office seeing the consumer, while the system is being the support that they need, and that's turned into real dollars for a saving for this agency. I think the other thing that the system has done on the administrative side is the way an agency under our system bills the behavioral health organization is through an encounter. So when a case manager or a doctor enters a note, that really turns into the bill that goes over to the behavioral health organization. That's how we are paid off the encounters. And one of the things that's really helped us is we have an electronic report that when you send data over to the behavioral health organization, before we ever even send it, it goes through all sorts of edit checks back here in our system. We know before we send data what the errors are going to be, and we have a chance to correct them. So number one, our data goes over to the behavioral health organization clean, but then if there happens to be an error that we don't catch, we get that back from the behavioral health organization, goes back through our system. The staff are able to correct the error so that we know as management when we actually get the bill exactly what we're going to get it paid on, because we've had a chance to know what the errors are and to correct them. So this system allows us, when we bill, to be able to reconcile before we ever even get the payment exactly down to which consumer we're going to get paid for and which ones we don't and why. So we can correct the errors before they ever even go. And that's something no mental health agency that I know of in Tennessee is able to do. In the mental health field, there's always issues that happen after hours. We happen to run the 24-hour mobile crisis team for Davidson County, and many of our consumers that are in the service of the co-op also get into crisis after hours. And this system allows us to know in real time when a consumer comes to the crisis area or when the mobile crisis team is called after hours for a crisis. Through an alert, the case manager gets immediately an email saying that the consumer is in crisis. The provider gets an email saying the consumer's in crisis. They can call up through the computer what medications the consumer's on and be able to resolve the crisis much more efficiently. The two systems are able to talk with each other. The other thing about the crisis is there's a elaborate assessment that the crisis workers do, and before we had the system, that was in paper. So what you had the case manager knowing that a consumer was in crisis, but then having to go to the paper chart to get the assessment. Now the actual assessment, the disposition, who was called, what hospital we sent the consumer to, if they did go, if they went to our crisis house, that's in the system, so that the next morning when the case manager comes in, they have the entire assessment that was done the night before. They know exactly where their consumer is, and the provider also knows where the consumer is and can go over and see them in real time, just like hospital rounds. They can go over and see them and see what medication they need. The crisis is resolved much quicker than it would have been had we had to chase the paper and not even know the consumer went to the hospital. Before we started the project, we had IS staff that, quite frankly, and I hate to admit this, I didn't have a clue what they did. Somebody just told me we need this person, we need that person, and we just seemed like we kept growing our IS staff, and I wasn't getting any product. They were going to build something for me. I never saw it, but I saw a lot of staff members, and I saw a lot of salary going out the window. When we hired Blue Wing, they brought consultants in, and now that they're getting ready to leave and they've left the system with us to continue, we've been able to actually decrease our IS staff. We have less staff now than we did before we had this system built for us. And that's been a big cost savings. We're much more efficient in terms of IS, and I, as the executive director, know exactly what the IS staff are doing. I can see in the system what the IS staff are working on, so I know exactly what each role and what each job description is, and I feel like I'm really getting for my money what I'm paying for. CEOs and management staff of mental health agencies don't speak business processes. That's not what we're programmed to do. We're programmed to work with people. They're also not programmed to speak computer talk. So when you get an IS department in that speaks a totally different language and they're doing things that you have no clue about what's going on, you can be in the dark. With this system, the business processes were our processes. They were exactly what we in our own language did. And then the development work that was done, it's in real-time, real-world language. I know from the system exactly what I'm getting and how it was built because I can understand it. And I think that's the benefit and the absolute lovely part of the system is it's not computer speak. It's built around what consumers and staff members do in a system that I understand. The system exceeded our expectations, and that is the honest truth. I have had more people that have had contract work come in for IS when they left to not be satisfied. I was skeptical in the beginning, but as the thing rolled out, I kept thinking, I don't know if this is going to work. And when Blue Wing now has left or is leaving, it has exceeded my expectations. Not only has the technology exceeded what I thought it could do, but Blue Wing Healthcare Consultants has totally exceeded what we were able to do. They brought the staff together. We know what we're talking about. From one satellite to the other, we're doing the same thing, across the agency, and it's been really, actually, more than I had ever hoped it would be.
First of all, if there's any question of what happens next, the first response is, what do the process charts say? So it's fabulous for keeping us aligned. And the saving in time, I think, for each service is incredible, as well as just the enhancement of the knowledge that they have in order for them to do their job. Case management, they're probably 25 to 30% of their time has been cut because of just the whole information system that's available to them. They don't have to go find nurses or doctors to hunt them down, or the administrative assistant to find out when their clinic appointment is. They don't have to try and find out what was said in the doctor's appointment, what would be the next refill for medications. All of that is available to them right there. So instead of asking what happened, they can follow up with the next step of, so this is what happened. My next step is going to be why. This is where I go from here. We need to get those prescriptions filled, or whatever it is. They would not change that for anything. They don't have to give us information about what they've been doing. We can go to the computer and find out what they've done, how many people were hospitalized. We can find out all of that. We don't have to say and go to the case manager, on top of doing your work, could you give us some more information, please? And they don't miss that. We might even ask them in passing, and they will refer us back to the computer. I think you can get that information, Kim. So it's great. They don't have to do that. Same with doctors and nurses. They can find out anything that the case manager has done, and if the crisis team, if they've seen them, they don't have to spend their time in team meetings going through everything that's happened since the last team meeting. They don't have to do that. They can spend their time problem solving about what to do for the next month, not catching up. So they're already ahead of the game and what they were planning on doing. The conversation is different. Nurses, their time is very valuable, and nurses and doctors are expensive. And so their time costs even more. And they have decreased their work, the nurses, by almost 60%, I would guesstimate. Matter of fact, we had a real hard time having nurses go out in the field because of time constraints. Not because they didn't want to, they were all for that, but they just didn't have the time. And our home visits, once we implemented this system, increased dramatically by probably 60%. So they had the time. They were saying, this is easy, everything's taken care of. I'm not just working for the doctor and rewriting the orders, and I'm not doing all that. I'm doing clinically what I really want to do. So as paperwork was gone. Everybody in the agency no longer has the clerical responsibilities and administrative responsibilities that they had before. We just don't have the need. It's not there. Everything that we need, everybody has access to. Everybody can find it themselves. Everybody's pretty independent about that, and it gives us information. The other thing is, frequently we will find, another area that we want to look at. Oh, we hadn't thought about, this particular area. We hadn't thought about kind of the cultural diversity in the medications. Well, we can create information for ourselves through the computer to look at kind of the cultural diversity in the medications, if that's really what, we would want to go through. It used to be that when we needed a report or we needed data, we needed immediate feedback about kind of what was going on with all of our consumers, we had to go to one or two people and say, could you produce this report? And we had to go through defining everything and letting them know what we wanted. Now, if I need that, I can do it myself. I can understand kind of the parameters that I want to build in the report, dates that I want to build in there. I can do that without explaining it to someone else and waiting for it. If it's not on their priority list, then, it would take a few weeks for me to get that. Now it takes, 20 minutes, 10 minutes, depending. That software has exceeded our expectations in being a proactive software system to help us stay on our toes. There is no longer the need for someone that has gone into crisis, for that program manager in crisis to call the case manager to let them know, to call the doctor and let them know. By that time, the crisis has occurred. The person has already been dispositioned somewhere, hopefully, that's safe for them, and they're giving information of after the fact. The CRM system already sets an activity for them to follow through with seeing that person. So the crisis director doesn't have to do anything. The medical director already has something on their personal system telling them, hey, you've got a consumer that went to the hospital and you need to do X, Y, and Z. So it sets that up already for them. And that, being proactive that way has been unbelievable. Blue Wings Behavioral Healthcare Software took us to an agency that we had never fathomed. We did the best we could at being proactive. However, just the nature of the business is very much a reactive service. So we have been able to take something that occurs in crisis and deliver kind of and set activities for what the next step is to all the other people that would be important in what their next step is going to be after the crisis, right when it's occurring. So it's not the program director of crisis calling around later saying, hey, by the way, last night at 1 a.m., I saw your consumer, and they're going to need to come in to see you today. When that doctor comes in, they've already got the activity. They know, this consumer is going to come in, and when they look at that, they're going to find out, oh my goodness, they went to crisis last night, and I need to do something, my part, my next step, this is what I need to do next. And that right there makes me sleep much better. The Blue Wing system has definitely exceeded our expectations and really prevents things from falling through the cracks. Everything's covered.
We actually were looking for a new accounting software package, so we actually were implementing Macola software, and upon further conversation and where we are with the agency, we actually were able to bring Blue Wing in. And once we actually met with Pam Womack, the CEO, Louis Johnston realizes that everything that our business does focuses around the consumer. So that's how he had the concept of bringing the consumer-related or customer-related management software here, because we have several different programs that actually revolve around the consumer. We have our crisis team, we have case management services, we have a clinic, we do several programs. We have a FACT program, that's a forensic action treatment team. We have a PACT program. We offer a representative payee service with Social Security. So we were able to incorporate and tie all of those programs that we have together through the consumer, and that's what the actually customer-related management software does. So in beginning with that process, what we were able to do is start with our business process engineering, and that way every business process was documented. And it just depends on how organized you are as an agency as far as how long the timing that it actually takes to get these put together. But we were able to capture the MHC intellectual capital from our different officers and directors and actually put that into the process engineering consultants who understood the computer automation and could actually bring all that together. Well, the actual business process engineering for the maximum efficiency came first. Then the consumer relation management ship we wanted was computer animated to enforce the processes. So nothing falls through the cracks without management being alerted. For example, with this system, we can look at any point in time and see where a consumer is within the agency. If they had a clinic appointment, we can see the last time that they were case managed and when they had a face-to-face contact with their case manager. We can check and see, tie in the representative payee to see if they have actually picked up their allowances, what bills have been paid on their behalf. We can know at any point in time where the consumer is. So it's a very efficient system. Well, the return on investment has actually been incredible, and it's just going to keep growing. From the get-go, we were able, once we got the system up and running, we were able to eliminate our data entry department and our medical records department, which that was about 8 people at an average salary of $30,000 each. That was right off the bat. The IS team, we actually were able to, once Blue Wing got in here and started doing the process and had some of their process engineers, we were able to eliminate about 5 IS positions at an average of $40,000 a year. With salary, that was a savings. And then the best thing has just been the efficiency. For example, with our nurses, the nurses have been able to increase efficiency by about 60%. For example, all of the time that it took for them to actually document their notes, they were averaging about 16 home visits, which is outside the office. That is for consumers who don't show up at clinic, who are basically no-shows. The nurses' statistics now are averaging about 80 home visits a month, which is just fascinating. They actually love it. I mean, the providers and the nursing staff can actually hands-on incorporate everything into the computer system right away. There is no paper. There's no more paper, even down to the electronic medical record. Well, we're actually going to still incorporate, on the management perspective, the human resources part will actually be incorporated into the system. But right now, our full year ROI is about $1,020,000. So it's just been incredible as the amount of what we've been able to save. And as far as companies, other companies, when you're looking at this system, your return on investment can be anywhere from 6 to 18 months. It just depends on how well your business processes are documented from the get-go. We're just so pleased with it because there is no other system out there, especially in the mental health field. And Pam Womack can back that up for sure because she's been in the business for 20 plus years, and she's just tickled to death to have this in place. It's wonderful. What we do is we bill our BHO, and within the electronic record, it ties all the progress notes, so they can immediately go through our data, the files that we send over, and see that there is a progress note, which just helps them to be able to go ahead and cut the check right away, because all of the documentation is there. There is no question on whether the consumer was seen or not seen. The progress note is also attached with it. Our relationship with Blue Wing has been nothing but incredible, and it has far exceeded our expectations as far as getting the system up and running and the return on investment.
I'm Chuck Mann. I'm going to demonstrate the beginning of a crisis episode, but I'm going to do it using the brand new tablet PC that Blue Wing has already adapted to using. And we're going to use one of the crisis forms to show that using the tablet pen we can quickly take choices, or instead of typing at a keyboard we can just write into areas of the form. Of course, the first thing is consumers come to crisis either by calling in, someone's calling in for them, they walk in, the police bring them in, there's any number of ways. And when the call first starts, the triage counselor starts looking for information on them. And they may, like I'm pointing to the last name here, they just may key in a couple letters. And we've got SM. We're looking for John Smith, and I don't have to key in the whole thing. Now that I have the crisis consumer form up and I've looked at any information that's there, I've done the triage assessment, and now this is the way that I would complete it. I punch the new triage assessment button, and of course it leads me through a series of prompts. Is this a risk zero? I take a yes, I take a no. It takes me through a series of legs. I'm going to take a no. This was a phone, so I'm going to mark it as a phone. It's giving me some information that it has no CRG or TPG information. Click OK to clear the message.